According to the American Heart Association, nearly 70% of the United States population has some level of heart disease. More than 230,000 Americans undergo coronary bypass surgery every year. The Heart Institute at Staten Island University Hospital has made groundbreaking advancements in the field of minimally invasive bypass surgery, developing a new technique that's transforming the lives of cardiac patients. The procedure is called MICS CABG, or the McGinn technique, named for its pioneer, renowned cardiothoracic surgeon and medical director of the Heart Institute, Dr. Joseph McGinn. What makes the McGinn technique different from ordinary bypass surgery?
Well, typical bypass surgery involves a fairly large incision in the middle of the chest. I typically call it the zipper. A lot of patients have it. It's been around for a long, long time. It's been around since the 60s, actually. It's a very old incision. It requires dividing the sternum or the breastbone. And by doing that, it creates a lot of pain, a long recovery, significant discomfort, and some disability as well. The one incision goes right down the middle of the chest and it divides the breastbone in half. It gives phenomenal access to most of the heart, but when we're doing coronary bypass surgery, we don't necessarily need to get to every part of the heart. What we do in the minimally invasive technique is we make an incision in the left chest in between the fifth and the fourth rib. That gets us access to most of the arteries of the heart. Getting access to the different arteries on the heart is facilitated by some very, very highly technically sophisticated instruments. One of them is what we call a positioner, or a starfish, that attaches onto the apex of the heart and rotates the heart around, exposing each of the arteries on the heart. The other major device that we need in order to do this procedure is the stabilizer. That's called the octopus. That's placed on the arteries and holds the arteries still so that we can create the bypass with tremendous precision.
With the McGinn technique, there are only 3 small incisions made and no need to break the ribs. What are the benefits?
The benefits of the McGinn technique, or the minimally invasive approach, is you avoid the cutting of any bones or muscles or breaking of any bones, thereby not causing any pain, disability, long recovery time.
Well, I had actually, in my role, I had spent some time over the prior 3 years talking about the very fine program at the Heart Institute and talking about the procedure that's been developed and perfected by Dr. Joseph McGinn. Little did I realize that one day I would actually need the procedure myself. As someone who resides in the city of New York, I really have the opportunity and the accessibility of the finest hospitals in the world. And I gave it some thought and then realized that I happened to be close to the finest heart program in the city of New York. And that's why I chose the Heart Institute.
With the traditional open heart procedure, I would not have been able to return to work. I drove myself in my own car to work, and you can't even get behind the wheel of a car for months after open heart surgery.
Dr. McGinn has successfully performed more than 600 MICS CABG procedures on patients of all ages and varying health conditions.
Prior to coming to the Heart Institute, I had a previous surgery at another hospital. We had some problems, and I had gone into cardiac arrest. Unfortunately, their cardiologists were unable to perform the necessary surgery, which ended up being a quadruple bypass surgery. They immediately, by ambulance, sent me directly to this hospital, Staten Island University, for the Heart Institute, specifically to see Dr. McGinn. I am young, and it was 2 years ago. It was extremely frightening. Today, I'm a much different person than I was previously. Only because faced with a life or death situation and knowing that this doctor came in and touched your heart with his hands and fixed you, fixed what was going wrong to help you live, you don't forget that.
Now that the minimally invasive approach to bypass surgery is a confirmed success, Dr. McGinn is improving the technique to fulfill the needs of the increasing number of people that need heart surgery.
While we're always continuing to improve ourselves and conquer new horizons, And I think the big horizon coming forward for us is to be able to create a platform that just about any surgeon could adopt. So we can make this procedure so easy to do that just about any surgeon could do it and apply it to just about any patient.
There are some techniques down the road and horizon that we'll probably be entertaining here at Staten Island University Hospital. We'll be looking into more of a hybrid technique.
Well, you know, there are a couple of times in medicine where things are revolutionized, and I think this may be one of them. Part of this revolution is the fact that the sternal approach, or the major incision, the zipper incision, has been around for so long. Like I said before, it was here in the 60s and even maybe before that. So it's been around a long, long time. And many thousands and thousands of patients have received this zipper procedure. This is a major change to go from such a big incision to a little incision for heart surgery. A couple of reasons why. Number one is the heart is always moving. So it's like operating on a moving target. The other thing is the operations we do on the heart are microvascular, meaning that we're using very, very small sutures, very small needles, small instruments to create these anastomoses. Makes it more challenging to do through a small incision. So having these devices available to facilitate this procedure has literally revolutionized this operation.
The Heart Institute. Bypass the ordinary.